meantime, you can book a healthcare professional or caregiver for a house call anytime. There's actually an app for that, and it's being called the Uber for Home Healthcare. I caught up with the CEO of Vencer Health, which is launching the new technology in Hawaii. And joining me now is Mark Salazar. He is CEO of Vencer Health Technologies over in San Francisco, based right now, but he's actually a homegrown boy from here in Oahu. Good morning, Mark.
Good morning, Annalisa. Shout out to my wonderful friends and family.
Yay! It's good to see you doing so well over on the mainland. So, Mark, tell us about this new app that you're launching here in Hawaii.
Yeah, so on Monday, June 15th, we're launching our beta testing for an app called Vencer Health. The app links individuals who are looking for personal health care or respite care to CNAs or RNs that are available in the area. So it's kind of go live for the first time ever on Monday.
Would you call it kind of like the Uber or Lyft for caregiving? Explain the dynamics.
On point. That is directly on point. If you know how to use Uber or Grubhub or any of those apps, this is basically it for healthcare. If you basically turn on the app, pick the services you want, and then it'll, like Uber, ping all these providers that are on, and then you can actually select which provider you want, and they will try to get, so our algorithms try to get someone there within 15 or 30 minutes of the address they want to send services to.
Okay, wow, that's so fascinating. So again, it's like on-demand healthcare, but we want to be careful because this is really not for life-threatening emergencies, right? You still want to call 911 or go to the hospital, right? Tell us about what kinds of procedures or help this is really targeted for.
Yeah, it's actually a preventative and healthcare management app. So yeah, like you said, it's not for emergency. So it's an emergency, call 911. That's not what the app is for, but it's for managing your healthcare at home. So if you are bedridden or you're caring for a loved one who's bedridden and they can manage their healthcare at home, this is the perfect app for it. So it includes personal hygiene, medication management, in-home transfers where you help somebody move around the house, that kind of stuff.
Mm-hmm. And how do you actually find the providers? Because people will wonder what kind of credentials a lot of these people have that are joining this app.
Yeah, a lot of providers are all background checked, and we make sure we follow the credentialing guidelines of Hawaii. So we make sure they are registered and are certified. We do run background checks on all the providers as well, and then we make sure they have their immunizations. Again, state regulations, we want to make sure that it's safe for them. And as you know, COVID-19 is kind of the issue right now. And so even part of the application process, we go through the COVID-19 screening questionnaire as well.
Yeah, you bring up a good point. So we're still concerned about the pandemic, a possible second surge because of all these protests and economy reopening. So how are the providers protecting themselves and their clients when they go out on these house calls?
Yeah, a lot of our providers, we make sure they have all the PPEs necessary. So there's going to be a checklist for them before they even leave their home. On the user side, we provide recommendations for them as well to kind of isolate themselves and make sure that the individuals, it's only the provider and the individual in the room and no one else. So we add in extra precautions because of this COVID-19 pandemic happening right now.
Yeah, and especially with people not kind of still fearing going to the hospital or going to public spaces where there's people gathering who may be sick. This really was something that, felt like an opportunity for you as a business entrepreneur.
Yeah, that's exactly it. I mean, we want to prevent anyone else from getting sick from COVID-19 and going to doctors' offices or hospitals for non-emergency services. Creates a situation that increases someone's risk. And so just by having your care provided conveniently at your home within 30 minutes or so, I think it's a great benefit for the individual, the provider, and kind of the safety of the entire public itself.
Mm-hmm. And so what about the cost? That's important for our people. So if I want to use the app for some home service, what is the cost to me, and how does the insurance play into this?
Yeah, currently it's cash-based currently, and it's market-driven. So providers at this point set their own rate. I think currently a lot of the services charge $25, $30 an hour, and we allow our providers or the providers to set their own rates. They could set it, as low as $10, $15 to high above 25 or 30, depending on how many providers are in the area and how many people are looking for services. So our goal is actually try to keep that cost down, and so our administrative fees are kept at a minimum, and we encourage providers to say, hey, you can charge a little higher because you don't have to pay the administrative fees on your end. We take care of all of that for you, your marketing, all your costs and all that stuff. And so we try to use those things to kind of lower those costs. So currently we're estimating costs between $15 to $20 an hour, which is relatively lower than the institutions or the businesses that you see that charge above $25 or $30 an hour. We are working towards insurance reimbursement. That these conversations that we're having right now, if we could get reimbursements from insurance.
Mm-hmm. So, on Monday, will the full array of services be available? How many providers are already on this service?
Yeah, Monday we have the full services available. So it's focused on personal care and respite care. Currently, we have about 50 to 70. We're completing a bunch of background checks at this point, and we are getting a lot of interest. We have a kind of a backlog of kind of doing background checks and all that stuff. So it's exciting to see that log, but still, the more providers we get, the better. So they can be available 24/7 to anybody.
Mm-hmm. And right now, you are just focused on Honolulu, on Oahu, or are you planning to expand? Like, what's your service area at this point?
We're doing this 2-month pilot in Honolulu, and then we're expanding statewide right after that for the next few months or so.
So these are all kind of independent contractor caregivers that may work at a hospital. They may work at other places, but this is kind of almost like a side gig for them. And is that part of kind of increasing potential employment opportunities in this kind of very difficult time for people who are out of work?
Yeah, I mean, a lot of the healthcare systems have been laying off individuals. Elective surgeries aren't there, people aren't visiting the hospitals or clinics. And so this is an opportunity for individuals who have been laid off or have received reduced hours to kind of create, like you said, a side hustle for themselves to make a little extra income during this kind of tough economic times.
Mm-hmm. And are they, able to join right now still? Are you still taking
definitely.
applications? Okay, give us that information.
Yeah, you can visit our website, vencerhealth.com, vencerhealth.com, and right smack on the homepage is Become a Provider. It's very simple, 5 to 10 questions at the onset, and right after that, it's an easy application process.
Okay, good. I know a lot of people are still looking for work out there, and if they have the qualifications and pass the background check, it might be a good opportunity for them too. So, well, thank you, Mark. I appreciate very good information. Looking forward to trying the app myself and kind of seeing how this home health care on demand works. But appreciate your time this morning.
Thank you for having me on.
All right, Mark Salazar there. He's the CEO of Vencer Health over in San Francisco, and it's launching its Vencer Health app here on Monday. Don't go away. Good Morning Hawaii. We'll be right back.
KITV4 Island News, honored with the Edward R. Murrow Award for Breaking News.